The team was in the National Assembly to meet with the Senate Committee on Primary Health Care and Communicable Diseases, where the representative of the World Health Organization stated that about 24 vaccines can be used to improve the health of children and adults and also to prevent communicable disease.
GAVI is one of the innovative mechanisms that we have worldwide that has been able to provide the world with predictable funding to send a strong signal to manufacturers that when they produce vaccine, there will be possibility of using those vaccines in the developing countries where we know funding is not usually available on the spot, while the need for these vaccines are greatest.
GAVI is concerned about the lack of vaccines in Nigeria, as well as the fact that Nigeria now has the highest number of under-immunized children in the world, and the immunization level is lower than countries like Mali, Niger, and some other African countries.
If I have to be honest, that we're quite concerned about the immunization system in Nigeria. I must say that the board of GAVI is very concerned about the low coverage rates, about the outbreaks, about the size of the population, and is willing to potentially consider changing slightly some of the policies on transition and work. But this is going to be dependent upon a strong commitment from government that they want to work on improving the situation and moving forward.
The present regime is prepared to strengthen the partnership with GAVI in bringing an end to death through the production of vaccines, as National Assembly is committed to restructuring the health sector in the country.
The Senate already synergizing with the primary health care in the area of advocacy, because it is important, and sensitization of the people here. You remember, especially from the polio perspective, we had problems that are centered on religion, sentiment, cultural and traditional sentiment, but thank God we've been able to come over that now, and the Senate is taking it upon itself to ensure that we are part of the advocacy and education and sensitization of the people.
A long-time partner with Nigeria, GAVI has reached more than 10 million Nigerians to prevent almost 1 million deaths and hopes to raise the figure to 20 million to prevent about 5 million deaths in the country.